Hello, hello, everybody. I am so excited to be here. I am your host, Micheline Bowman, and this morning I had to put my glasses on because I want to have an opportunity to talk to all these amazing doctors and mental health experts. But before I start that, I want to make sure everybody knows that I too have tried to do my gardening in my container. My curl parsley is not looking too edible right now, but I think she might need a little bit of water. So I want you to know that I'm doing what I'm supposed to do, following on with this session. So I'm gonna put my parsley down and so I can jump in here and speak to the doctors that are on deck. So clap to everybody who has joined me this morning. I have a lot of questions. Facebook, Zoom, everyone has a lot of questions, but what I want to do first is I looked at everyone's bio, and of course, you all have done some amazing things in your life, but I want to give you each an opportunity to first introduce yourself and then just tell us your expertise. So when people want to ask questions, they know exactly who they are talking to. So let's start off with Dr. Jennifer Sun. I see that you're on here.
Hi, hello everyone. My name is Jennifer Sun, and I am a breast surgeon at MedStar Georgetown and MedStar Montgomery. A little bit about me: I am from Brooklyn, New York, but I ended up going to medical school in Boston, followed by surgery residency in Chicago, and then San Francisco for fellowship. And now I am here working in the DMV area at MedStar. So I'm happy to take any questions about breast health, any breast conditions, anything like that. And I look forward to being on this panel.
Okay, now I'm going from left to right the way I'm seeing you on here. So if I'm jumping over you, everybody, don't think it's because I don't like you. I'm just moving the way that I see you on my screen. So next I have Dr. Nancy Richburg.
Good morning, everyone. I am excited to be here this morning. My name is Dr. Nancy Richburg. I'm a clinical pharmacist and a certified diabetes care and education specialist. And I am teaching the Kickstart Your Health series with the Chronic Disease Management Program. My background, I'm originally from Philadelphia, and I lived in Maryland for about 3 or 4 years in the Montgomery County area. And so it's great to be back with the residents of Montgomery County. And I'm excited to be here. I love talking about disease prevention because I believe predisposed is not predetermined. So I look forward to the questions.
All right. And moving on to my left, I feel like we're the Brady Bunch here. I have Dr. Is it Ikena Myers? Am I pronouncing your name correctly? Please correct it if I didn't.
Dr. Ikena Myers, and thank you, Ms. Bowman. Thank you, everyone. I'm definitely excited to be here this morning. My name is Dr. Ikena Myers. I am an internal medicine physician by training. I have a deep interest in health disparities and health disparity research. I did a fellowship at the National Institute of Health, Health Disparities Institute. And ever since then, I have also been working as the clinical director of Healing Our Village. I am currently the African American Health Program Supervisor, focusing more on the clinical aspects. And I'm soon to be Assistant Professor of Public Health at the George Washington University.
Okay. And now moving right along, we have Dr. Joseph Latta. Now, Dr. Joseph, I have got to talk to you because Latta is my family's name. And I'm like, we might be related, so.
My goodness, it's a small world, isn't it?
Yeah, so I'm gonna call you, hi, cousin doctor.
Yeah, good morning, everybody. My name is Dr. Joseph Latta, and I've been practicing, I guess it's been longer than most of you people on this panel, maybe 40 years as a pediatric dentist. And my goal has always been prevention and how to prevent tooth decay, but how to prevent any kind of oral disease in the patient's mouth. And our whole goal is to train our patients to become friendly with the dentist. In other words, starting out early so that they will go to the dentist and they will practice good oral hygiene.
Great. Dr. Langston Smith.
Good morning and thank you. And it's good to work with Dr. Latta again at AAHP. And also I'd like to compliment AAHP and for putting this program together. It's been such a successful program over the years. But I am Dr. Langston Smith, and I'm a board certified endodontist. Like an endodontist is that individual who's specialty trained to do root canals. And even though we do root canals, I also, along with Dr. Latta, we believe in prevention, because when we prevent the problem, then you won't have to see me for the root canal. But I did my dental training at the University of Kentucky and my specialty training at the Navy Postgraduate Dental School there in Bethesda. I'm a retired Navy dentist, 30 years in the Navy, and 12 years on the faculty at the College of Dentistry down at Howard University. I have a definite interest in advocating not just for dental health, but for total health, especially for those who have difficulty accessing care. And I think, as we've already said, that we need to prevent, but I also want to be able to discuss with our people today, how does dental health relate to total health? You see, the mouth is the window to the rest of the body. And so whatever comes into the mouth, or however it is used, impacts the rest of the body. And so my focus today is to talk about how dental health is related to total health. Okay, it's good to be with you.
Thank you so much. Dr. Eric McDonald.
Yeah, thank you. Thank you for having me on the panel today, and I'm happy to be here. I'm actually a native of Montgomery County. I grew up in Gaithersburg, Maryland, and I work for Kaiser Permanente. I'm an emergency medicine physician. I've been with Kaiser Permanente for the last 5.5 years. Previously, I was at Southern Maryland Hospital Center in Clinton, and I spent time before that in the military. So I share military. I was Army, not Navy or Air Force. But I did 9 years in emergency medicine, had a chance to deploy to Iraq, Pakistan, Kosovo, and several other places. And very interested in health, as well as just understanding the effects of this COVID pandemic. I'm currently working at Six Flags. We're at the vaccination site out there, and our group, Kaiser, we've actually been doing the medical observation and the treatment of anyone having reactions. So we vaccinated over 300,000 Maryland members. So we're very, very proud of that, and very glad that we had a chance to do that. And so, we've been, there with the pandemic through the vaccines, as well as in the very beginning, taking care of patients in the urgent care, and even daily seeing patients in the urgent care. So that's a little bit about where I've been and what I've been doing.
Thank you, sir. And Miss Aisha Taylor, our mental health expert. That's right. We got to smile, makes us all our mental health feel good. Everybody only need to be smiling. We alive here.
We need to smile and we need to breathe. Absolutely. Good morning, everyone. I am Aisha Taylor. I'm a licensed clinical social worker here in Maryland and also in New York. I am from Brooklyn, New York, of course. I know people out there. Yeah, go Brooklyn. So I am licensed in Maryland. I have a private practice here, and I also supervise social workers for a nonprofit in New York City called Prep for Prep. I also work with Montgomery County Public Schools, and I am truly passionate about being on this panel with all these passionate professionals. And thank you, Ms. Pat Grant, Arlie Wallace, Mr. McFarland. Thank you for such an auspicious invitation. I'm really happy to be here. And I work a lot with families. I work a lot with children. And oftentimes it's really hard to find practitioners that you feel you can relate to. So I know early on in my first job in the field as a social worker, before I actually got my degree as a counselor, I fell in love with the work. And I started working with teenage girls and went back to school and have been committed to our community because it's so important to be able to see someone across the room from you that kind of looks like you and you feel like you can connect to, and it's really important. So I'm really happy to be here today and to join the panel. Thank you.
Well, don't say thank you, because that means you're going someplace and you're not. First, before I keep going, did I miss anybody? Because when I see all my family on here, I don't want to miss any other doctor that's joining us. So did everybody do their introduction? We did. We all good? All right, because you guys are muted, so I'm the one. Y'all can hear me. Everybody's good, right? Okay. So what I want to do is, Ms. Taylor, because you were last, the last should go first. How about that? And because we are in Mental Health Awareness Month, and it's an important time to have mental health all year long, not just 1 month. We should be recognizing the need for us to all just be mentally sound and happy and feeling good about it. I just want to get your thoughts overall to give us some type of something that we can all take away from today that can carry us forth, just to be more in tune to things that we're going through, because the pandemic has really hit every profession, everybody, and some people are dealing with it great and some people aren't. So what type of inspiration could you give us to have us feeling good this morning?
So first I want to start off with a really awesome resource that AAHP has on its website. It is, again, Mental Health Awareness Month. It is an area that oftentimes is easy for us to overlook and forget and not take care of, right? We forget about that top half, right? That head, what's going on here? And I invite and encourage everyone that's listening to go on AAHP's website, because they have a free and completely confidential really quick assessment tool that you can use to kind of screen and see, should I be a little more concerned about myself? You can go on there. It takes about 5 minutes to fill out the screening form. And again, it's confidential. You can fill it out for yourself. You can fill it out for your children. You could fill it out for your grandchildren and spread the word. Tell everyone you know, hey, you should check this out, and just, take a screening. And that's a great way to see what additional resources we have here in Montgomery County, because after you finish the screening, you get a list of resources that you can tap into. I definitely.
I'm sorry.
Mhm.
Forgive me for jumping in, because I have so many questions that I want to ask everybody. I know I can't keep y'all all here in my living room. Well, I'm in my dining room forever. But I do want to ask, because one of the things with mental health, and I'm making this a personal thing that I'm sure somebody can relate to. Growing up, mental health really wasn't discussed. You might have had an aunt or uncle or somebody, and the word for African Americans, at least in my family, they are touched, or Aunt Susie or whatever, she's special. And the whole stigma of words, and realizing that mental health has been around longer than all of us on this Zoom has really been, here. But for me nowadays, I'm trying to understand, how can you make sure that the kids, because nowadays, especially with the pandemic, mental health hasn't, as far as I'm concerned, been really focused on children. So what can parents or grownups look for into our kids to make sure that they're okay?
And I'm so happy that you said that. Mental health has been around forever. As long as there have been people, right, taking care of our mental health needs to have been a thing. In our community, unfortunately, whenever I have an opportunity to speak to Black people, I'd like to let you all know how serious things are. So right now in Montgomery County, the numbers of Black people being seen in psychiatric emergency rooms is way above that of our white counterparts. And even more alarming, as a parent myself, the rates of our Black children committing suicide is growing. It's growing and it's growing. So in the matter of a decade, between 2007 and 2017, the rates of, and hear this, Black boys between the age of 5 and 11 has doubled, right? So this does not need to happen. It's preventable completely. And there's so many reasons, like you mentioned, the stigma in our communities, the lack of resources,
right, the
lack of culturally competent resources, right? So as a parent, even as a professional in the field, it's scary. I'm bringing my child to meet with someone that's going to kind of get into their head. I don't know about that, right? And we have a history of the medical industry not treating us as well as we need to be treated. So it's very, very scary. And now we have the pandemic, and there's so many new things, right? I was reading recently about Zoom dysmorphia, right? So now our kids are so hyper aware of what they look like on these screens and the filters, and then they're going back in person and they're not feeling comfortable. But the important thing that I feel like that was a lot of bad news. I'm sorry. a lot of bad news on a Saturday morning. But the good news is there are protective measures you can put in place easily in your home.
That's good.
And what does that look like? That looks like making sure there's, maybe you're having regular family meal times so that your children have an opportunity if they're stressed or struggling and they need to connect with you. It's right there. They don't have to take the extra step of finding you in your busy schedule because they already know, oh, every Sunday we go to the farmer's market.
Let me just jump in there I know because mental health, you're passionate about it, but I want to make sure we get to all the different components of our health, the doctors that are on here. Now, I thought I saw Dr. Lawson. Did he jump off? Because I know he's your counterpart and I wanted to make sure I had an opportunity to speak with him and I don't see him on here anymore. Dr. Lawson.
Jumped off.
Is he there?
I think he jumped off.
Okay. Well, we're going to keep going because I want to make sure that we all get as many questions answered and things out there because, again, I am involved in all this from the head to toe. So since you started with the head, I'm going to keep it going with the oral care and oral health because I am such a component of having everybody understand that the mouth is the gateway to every liver disease in our body. If we take care of our oral care and oral health, that systemically will affect everything from our hearts to our kidneys to our lungs and all that. And people think I'm crazy when I talk about my mouth all the time and teeth, but I say that's your first introduction to anybody. If they look at you, they see you smile, and a lot can be misconstrued from the smile. But with that being said, I definitely want to talk to my dentist about it. Dr. Latta, I'm got to go to you first since you have that family history name, but what can you share with us and people tuning in the importance and understanding the relationship between tooth infections and cavities? Because we all have some type of gum issues going on, gum disease, bacteria in our mouth. And a lot of people think, oh, it's a cavity. I'll just, I'll brush and floss and keep it going. What people don't understand is that that cavity can actually end up taking your life if that infection gets into your body.
Well, I'm glad you sort of hit on the idea of the importance of the oral cavity. And I think that we've all got to look back and think about what's happening today in the COVID-19. Well, it really affects the upper respiratory system. Okay, and when you think about the upper respiratory system, what are you talking about? You're talking about the nose, the sinus. You're also talking about the oral cavity. And so we have to focus then, how do we maintain that area and make it an area that's hygienically that's hygienically stable. And so I'll talk about that and also talk about the tooth decay. The thing about tooth decay is that it begins early on. When you think about a woman who's pregnant, 6 weeks in utero, the first tooth begins to develop in utero. And then 3 to 4 months, what happens is that a cap starts forming on the tooth. It goes through the stages, the bud stage, the cap stage. And in the cap stage, with the 3 to 4 months, what happens is that the enamel is forming. And so we tell the parents to be sure that you don't take tetracycline at this time because that will affect the enamel formation of the tooth. And then it goes into actually a bell stage, and that's gets the roots and everything are formed. And then the tooth erupts. So we have to be careful now because as soon as the tooth erupts, we got to make sure that we take the child. The first visit to the dentist is when the first teeth start to erupt, and that's your first birthday. And so we want to make sure that we understand that the cavities occur in children before anybody else. And so the baby's teeth are very prone to that. And so we want to make sure that we get them into the dentist and we get them on a healthy program. And when you start someone out early as a parent, you want to make sure that you do what we call tell, show, and do. You tell them that they're going to the dentist, but you make it a friendly visit. You tell them that little Johnny, little Mary, you know what? I want you to open wide like an alligator, open eyed like a hippopotamus. So when you go to the dentist, you're going to the dentist and you're really going to have a nice time. And so I think these are things that we're encouraging people. It establishes a good mental program for the young child. And then when you have that positive approach for the child, they won't be scared of the dentist and they'll take care of their oral health all during their growth and development. So, there's other things, you're going to have toothaches and all these things. But like I mentioned before, I like prevention. And prevention is very easy. And all you really do is make sure with your child that you bring them to the dentist every 6 months. You make sure that they're getting their sealants. You show them how to floss and brush and rinse. And when you do these types of things, the only visit you have to the dentist is you're going to the dentist and having a good time. And that's essentially what we want to make sure that the children are doing and that everyone is doing when they go to the dentist. It shouldn't be a traumatic experience. And it only is a traumatic experience when you have not been going, when you're neglecting your teeth.
I want to say, and I could be wrong, but everybody on this panel has had their own experience with going to the dentist and how it made them feel initially. Because I feel like, everyone thinks that our teeth are going to last forever, but they're going to only last as long as we take care of them. And I didn't get my first cavity till I was 29 and I'm about to fall off the chair. When I have friends that had cavities as little kids, I'm thinking, a cavity? I'm almost 30 years old. Can't be. So, but again, you can do all you can to take care of your teeth, but sometimes, you have to have those checkups, like you said, to make sure it's the preventative that's going to be this, I guess, what sustains our teeth. Dr. Smith, can you chime in there about the dental world and dental students, especially, we are people of color that are on here. And growing up, I did not see a dentist of color. Every dentist, pretty much every doctor that I saw was not someone of color. So the fact that I'm on here with people of color, it makes me feel that, what, we can. And, there are lots of students in dental school right now becoming dental professionals like you. Can you chime in and let us know about programs and things that are out there for those who are watching who maybe have considered dental school, but are still kind of on the fence about it?
Okay, thank you very much. I will sort of give you a little background about the dental school, the pathway to becoming a dentist, and how we get into this process, and then talk about what's out there as far as mentoring programs or what have you. Becoming a dentist is pretty much parallel to the path we take to become a physician. The undergraduate program is basically one of biophysiological sciences, math, physics, chemistry, and what have you. And that is the same path that physicians take. And then once that is completed, usually the GPA that is looked at for dental students, for students to get into dental school, is roughly around a 3.57 in the total, or 3.48 in the sciences. And then you have to take the dental aptitude test, better known as the DAT. And the average score to get into dental schools based on the DAT is about 18.3. The student would then write a personal statement, and that personal statement talks about your passion and your interest for getting into dental school. Now, in 2000, there are 68 dental schools in the United States. Each dental school, the dental schools totally take in about 6,000 students, new students each year. So in the first year class of dental students, there's about 6,200 seats. In 2019, there were 11,000 applicants for those 6,000 seats. Out of those 11,000 applicants, only 717 were African American. So we had an entry rate of 6.4% African Americans, whereas the Hispanics had 10.7%, Asians 23%, and Caucasians 47%. So we're doing better. It's getting African American students into dental school, but not where we should be. So how do we address that? The Robert Wood Johnson Foundation has partnered with several schools to have summer enrichment programs. And what we invite students to begin to do is, even in high school, to begin to visit the dental office, talk with your dentist, shadow a dentist's office, and then ask that dentist to mentor you. Many schools themselves have programs by which they are recruiting dental students. And in local dental societies, for in this particular area, the Robert T. Freeman Dental Society advocate to get students into the programs. So there is a move to try and increase the number of African Americans in the dental profession. But those are basically the basic pathway to dentistry.
Thank you so much. gosh, I'm telling you, I can talk to every single person on this screen forever, but I definitely want to move on and get some female power in here on this discussion this morning. And Dr. Sun, let's just get into it. Mammogram, something that a lot of women are like, oh, I don't want to go. I don't want to go for this. But mammograms, when you get to a certain point, they are so important in the overall health. And we have women on here that I know. Dr. Nancy, I know. She's like, yeah, I know. So let's just get into talking about that. When should mammograms be done? And insurance, let's talk about insurance is covering it. So a lot of women will say, well, my insurance doesn't cover it, so I won't get it, but we got to get women to understand, and even men, that breast cancer, because it does affect men as well, but mammograms are so vital into the overall health of us.
So yes, you are correct. First of all, mammograms start at the age of 40 years old for every woman with average risk. If you are at higher risk for breast cancer, meaning you have family history of breast cancer, prior breast cancer, increased breast density, then we screen you a little bit more frequently. But in general, every woman should get a mammogram starting at the age of 40 every year. Men don't get screened for mammograms, but if they have any breast concerns, they should definitely go see a breast specialist. And it is a myth that mammograms are not covered by insurance. They are most definitely covered by insurance, starting at the age of 40 or sooner if you have an issue.
I love that. I mean, that's not something people look forward to going, especially women. But let's talk about right now with COVID. And I know there have been people out there saying, well, COVID is going on. I should get my mammogram. Maybe I shouldn't, maybe I can catch something from going. But, is that a myth that women should wait because we've gotten a vaccine or we haven't, or because we have this pandemic that we should or should not go to still get our mammograms?
Right. So let me just dispel that myth. I feel like initially in the pandemic, no one wanted to go to the hospital because everyone was afraid of getting COVID. And yes, that is a completely reasonable concern. But now we're living with COVID and mostly everyone is masked up, but everyone at the hospital, everyone in the mammography suite, everyone is following precautions. So cleaning things, everyone's wearing a mask. And so getting your mammogram is essential, and no one should put it off any longer because they're afraid to get COVID. The second point I want to make is that if you have had your COVID vaccine, that's great, that's fantastic. But we ask for you to wait 4 to 6 weeks before scheduling your mammogram, because sometimes the COVID vaccine causes some inflammation in your lymph nodes, and you can see that on mammography and people will get concerned. So again, if it's a screening mammogram, you can wait 4 to 6 weeks after your vaccine to get it done. However, if you are having a concern, you feel something and you're very concerned about this, please do not hold off. We will do the mammography and we will work this up. But yes, please get your mammogram. It's just the part that I want to stress.
No, I appreciate that, because again, I know that when I had to go initially, as far as the girl chat and men, I'm sure you have women in your life, that's something that as far as the girl chat, it's like, oh, have you gone? And I feel that trying to get everyone at that age to understand the importance is our own health. We have to be our own health advocates, and we should be the best reason why we go to this every year. And like you said, if we have any type of family history, that's even more of a reason that we need to go. So I thank you very much for that. Dr. Ikenna Myers, you've been sitting there looking kind of comfortable, sir. But now it's time to come up off of that. Yeah, that's right. You were looking too comfortable. I said, no, you got to keep on with this Ask the Doctor questions. And I know you were ready to answer some questions. And one of the ones that I want to ask you is because I have been plant-based for a year and a couple of weeks now. Changed my life. I don't push it on everybody. It's just something I pushed on myself. It's changed my life. It's changed everything, how I feel. It's changed my joints, everything. As a doctor, I'm sure you see people with high blood pressure, diabetes. You probably see across the board with all types of things. How have everything that you've been dealing with COVID been affected with some of your patients that may be suffering with some of these illnesses that I mentioned, high blood pressure, obesity, diabetes?
Right. Well, I personally, I'm not seeing patients because I'm more on the preventative side. more of the public health side, but just the impact across the board that I've seen in people that I've interacted with, some people that are part of some of the programs that the AHP is a part of, as well as the men's health program that in classes that we're teaching for the Housing Opportunities Commission. It has had a huge impact, not only in just the day-to-day lives that people have, but also on the impact that they've had on themselves, but also their families. And so as African Americans, we are a lot more susceptible to chronic conditions. We have poor health outcomes for all the chronic conditions that you mentioned: diabetes, cardiovascular disease, as well as obesity. And with that, when you have those chronic conditions, it can cause inflammation within the body, as well as it impacts your immune system, right? It impacts your immune system. So with that, if you do catch COVID, you are most susceptible to severe illness, right? And so, most of the things that we've really been saying and talking and preaching with the African American Health Program is centered around education, helping people to get the tools and resources that they need to have a positive impact on their health, whether it be through health education classes, teaching them how to eat better, plant-based in some cases, and meeting people where they're at, as well as possibly helping them get screened for hypertension, glucose, diabetes, BMI for weight, because all of those are important, and knowing your numbers are definitely important and having impact, especially among African Americans. There is a huge impact due to some of the influences and impacts that structural racism and social determinants of health have had on African Americans as well as Latinos due to COVID, and has increased and greatly increased our susceptibility, and as well as COVID's access to minority communities.
Dr. McDonald, I would love to hear your thoughts. COVID, some people, they think it's a myth. I don't know how, when we have been watching people around our entire globe suffer from this, pass from this, and now with us having the vaccine, there are people who have their thoughts on, should I get it? Shouldn't I get it? But as African Americans and people of color, we have seen this disease pretty much affect all families in our community, from the youngest to the oldest. And I tell people, it doesn't matter what your stance is, it's your own personal stance. Should you get the vaccine or should you not? But COVID is something that is real. And so is there any advice that you can at least share with us for those who are still kind of on the fence? My thing was, I tell people, and this is just me, some people, you take medicines for high blood pressure, diabetes, you take medicines, you take a Tylenol, you take whatever you take, and you don't know every single component. But if someone tells you it's going to stop your headache or it's going to lower your high blood pressure, you take it. But now I feel like with the vaccines, people have come up in this hysteria, getting people to not want to deal with it. And I say to people, it's science. If you don't believe in science, then why are you believing that a scientist is telling you that this is going to help your cholesterol, your high blood pressures, versus this is going to prevent you from getting as sick if you should get the disease? So that's just my 2 cents. I want your whole dollar.
Okay. No, I think that's it exactly. I mean, I think that, the whole thing about the vaccine is, now we have a chance to fight this pandemic and this disease in a different way. And it's really sad. I mean, I have the privilege of actually working in the urgent care, so I can take care of patients who are unfortunately are still catching COVID, and seeing, the effects of the disease process, and as well as the effects on the healthcare system in general. But then I also have a chance to work, at the vaccine center, on the mass vaccination side, and seeing, we were doing almost 5,000 vaccines a day at our site. I mean, we made it about 5,000. Now the numbers have come way down, but just seeing people excited and seeing people going through, and the number of actually adverse reactions to the vaccine, it was very minimal compared to the number of vaccines we were given. But to see people come through on both sides has really given me a lot of insight. And one of the best things for healthcare providers that I can say, when I'm doing an interview with a patient and I found out that they've gotten the vaccine, both doses, I'm very happy about that. But I would just say that, this is one thing that we can do that gives us another way to fight the pandemic and to fight this virus. The virus, like you said, is very real. It's a sad thing to see patients going through all of the different elements of just having this disease process. And so, when there's a chance to, either avoid that or mitigate those effects and make it so that's more minimal, I'm always very excited about that opportunity. And so anyone who's thinking about not getting a vaccine, the other thing that's really sad, if you look at other countries, there's countries where people are just, they would wish they had a vaccine. They don't have access to it. But in this country, they've done a great job of rolling the vaccine out, so we have access. So it's really our best weapon against this virus. And as the country opens up and as people start, loosening the mask restrictions and things like that, having a vaccine is going to be very important. I just can't stress that enough. That's very, very important.
I think that we can all agree that we've become a society where we're all looking at each other's eyes, trying to figure out who's that behind the mask. So when these masks come off, we're like, oh, I didn't even know that was you, because there are people recognizing me from my eyes. So now I'm like staring at people trying to figure out who they are now, which is like crazy. But I still feel comfortable keeping my mask on. I still feel that because there are so many people who are against getting the vaccine, and because depending on where you're living, that they're releasing the, I guess, restrictions are easing, where they're saying you don't have to have a mask on now. But how do you know if someone is vaccinated or not? Because there are some people who want to just, I guess, assimilate and say that they are, so people won't ostracize them because they do not want to have the vaccine, and so.
Yeah, that's it. And the other thing is that, I know that we're loosening mask restrictions, but there are some situations where I think a mask is still important. If you're in close quarters with people, if you're in large groups, there's times when you may want to still consider, you should consider still wearing a mask. The other thing that's still kind of scary is these variants. There's variants popping up all over the world, and, we still don't know the full effect of these variants. So, my approach is, we've made it this far in the pandemic, and I'm glad that, we actually have a vaccine, but we still need to be cautious. That's what I tell my kids. I have 3 kids who are anxious to get out there and explore the world, but I'm like, you guys need to be careful because, we still don't fully know. So you just do everything you can to protect yourself and be cautious as we go forward.
Besides, there are some cute masks out there, and I'm enjoying
That's right.
seeing all the cute masks with the blings out, and everyone's advertising on their face, so to speak now.
That's right.
Dr. Nancy, I've got to speak with you because pharmacists, wow, I tell you, y'all some special people. When you go to your CVS or Walgreens or wherever you go, I know that I'm the type of person, even though a doctor might prescribe me something and I'm at the office and they'll tell me what it's for and all that, but still when I get to the pharmacy to pick up that prescription, I still have questions. And sometimes I notice they'll ask you like, do you have a question for the doctor? If not, hit here, and they take your money, you keep going. I'm that type of person. I have a question. I want to understand how to pronounce it. What's it going to do? Do I take, because sometimes I forget, do I eat before, eat after? But your job is to make sure that all that and all my questions get answered. So talk to me a little bit about your role as a pharmacist and how do you discuss information and prescriptions and side effects and all those things with people that come to you?
Well, good. That's a great question. And I think you are my favorite and ideal person that walks into the door. I love talking, and I love talking to patients, and I love patient education. That's something that's been prevalent through my almost 30-year career as a dispensing pharmacist. So there's different roles for pharmacists now. People are starting to learn them, but in a dispensing role, when you walk into that big box pharmacy or your mom and pop on the corner, when you come in and ask us those questions and we say, do you have any questions? It's something that we're required to ask. But I love when people actually say yes. I'm like, don't you want to talk about this? And so that's a great opportunity. And that transaction at that cash register is so important. First, I want to highlight and say, please put the cell phone down. That is not the time to be on your cell phone when you're at the register. And I love some of the chains that won't allow you to come forward if you're on your cell phone, because a lot of things are about to happen during that transaction. And I've had people purchase things that are $500 because they just say, oh, yeah. And then they get the receipt and walk out the door. And once you walk out the door away from that counter, I can't take it back. And so it's important to hear that. Now that's something that's minor, but when we say, do you have any questions? Prime time to say, well, how do I take it? What should I look for? Is it going to make me sleepy? Is it going to make me drowsy? Can I drive? Can I work? What happens if I'm allergic to it? And this is, we want to talk to you about it, but if I just start talking to people, they look at me as if I'm wasting their time. But this is your next step after you leave the doctor's office. If you haven't written down a list of questions when you go into your physician's office, and talk to your doctor, they'll let you take notes. They realize also, and I'm speaking for them, but they're right here on the panel, that this is a lot of information sometimes that we're giving you at one time. And as you process it on that 15-minute ride to the pharmacy, oftentimes people will sit there and say, well, I don't even know what I'm taking. What is it for? I don't know why he wants me to take this medicine. And I know that he's told you this in the office, but you just didn't process it. And this is a prime opportunity for us to discuss it. We know more in addition to what the drugs are. We also know what they're used to treat typically. And through that communication, we can reinforce how you take it. Do you take it? Your doctor wrote for you to take it in the morning. Some of the medications, even the psychiatric medications, you start off in the morning and move to the nighttime. And these are times to ask those questions. I like to think of it as back in the day before GPS, when you had to give people directions, right? And you tell them, well, you're going to go all the way down 301, but if you pass X, you went too far. And that's something that can happen with medication. You're going to take this every day, but if you start to have muscle cramping, let me know. Or if you start to have, if you start to notice you're stumbling or you're sleeping too much, that's the time to start talking to me again.
I was going to ask you that. I know that, for instance, I'm going to reach over here and get mine.
Okay.
These here. These things here.
Oh, the book.
Because they give you a whole thing of what you're supposed to do, and I turn it and I read it, and I try to understand this. But I am 100%, because I just got this yesterday, as a matter of fact. But I'm 100% with you when you say that you got to ask questions, and I'm that person, because what happens to me might be one thing, what happens to Dr. Sun might be something, but we're taking the same thing. So we need to make sure that we understand our own bodies. Like you said, if I'm getting dizzy, Dr. Sun might be fine, you know. Dr. Myers might say, well, it makes me feel like that. So sometimes I wonder, does it matter if it's the same brand, if it's the, I guess, generic brand versus the name brand? Is it still the same brand? Because that's the one thing I always wonder. Because sometimes I'm thinking I'm getting one thing and then I can't read it and they go, well, that's the generic brand. Some might think that's the difference between, no offense, Walmart and Nordstrom's sometimes. You know?
Well, the active ingredient is the same.
Okay.
So if we are allowed to substitute with it, that means that it has met specific requirements that allow for us to automatically substitute. Now, are there some drugs, some medications that have what we call a narrow therapeutic window? Those then require us to reach out to the doctor. There's a communication. Different states will have different laws. But every state, I believe every state in the United States require the brand name. If we substitute it, the brand name has to be somewhere on the label as well. Before you take any of the medication, if you're not sure, call and ask. There's always a 24-hour pharmacy open. It doesn't have to be the one that you went to, and you can ask, what is this original brand name for? And they can let you know. Google is not always correct.
Or WebMD, I'm sorry, I'm gonna say WebMD has me losing a limb. WebMD has me going blind. I do not, and nothing against WebMD. I'm just saying, if I start typing something 9 times out of 10, I'm not gonna be here tomorrow. I got something going on.
It's great to ask those questions, but they are regulated on what we can and can't substitute. Some things are different dyes, some of the inactive ingredients. So if you have a particular allergy to something like yellow dye or red dye, that's an important thing to let your pharmacist know, because it's even in white tablets. So it's important to let them know that you might have an issue or concern about dyes or colors.
Now, one more thing I want you to say before we move on is that I want to make sure I heard this right, that once I come up to the register and I receive my prescription, if I have not asked the question and I walk to the door and come back, that's it. I cannot say, well, I want to exchange this or I can't give that back.
Most pharmacies will not take it back because that gives the illusion that we're going to redispense it. We're going to give it to someone else. Okay. And we don't do that. So once it walks away, I can no longer say, how was it kept? And so you have to discard it and throw it away. And some of these medications are expensive, and it starts to deplete your inventory, and people will come and they'll say, I don't want to take this. And so if it's expensive and you're paying out of pocket, meaning you're not paying a $5 copay or a $0 copay, but you actually have to spend that money and you're not sure if it's even going to agree with you, there may be an opportunity for you to ask to purchase less. So can I get a 2-week supply or a 1-week supply and see how my body reacts to this before I go ahead and I purchase it at $150? And it's hard to give those prices out when you know that someone is struggling for those prices. So oftentimes I will offer that, but communicating with your pharmacist when you drop it off, when you come over, every pharmacy now has a consultation area. You can ask to speak more discreetly and not at the register and have that time. That's something that's great with COVID is everybody has to stand back 6 feet. So that's an opportunity to have that private conversation. And I've even often would ask patients if they felt like they had all the answers, but it was a sensitive medication. If they want to go ahead and take it and call me, we can do the consultation over the telephone because they want to be in the privacy of their home. So we are always open to that. And I know your pharmacist looks super busy behind the counter, but they actually are there and want to help you. So it's okay to say, when you have a moment, can we speak privately? Can we step down here? And they want to help you. That's something that we all went to school for and we enjoy. So they look forward to that. And you may even start to see pharmacists embedded in your doctor's office that gives you an additional opportunity to speak with someone that is honing in on the drug and the drug side effects and how it affects your body.
I need to, after we get off of here, find out where you are so I can come visit you and my questions about, well, not that I want to take medication, but I have questions, so I want to ask you.
That would be, you talk to my key thing I want everyone to take away is that talk with your pharmacist, spend that time, and it's great. We want to be part of the team. Our ideal position is to find things on the front line, so to say, because we see you sometimes every day, and relay that information back to your care team in the medical office.
Love it. Thank you so much. I see that Dr. Lawson, he has joined us again, and I want to make sure, we missed you in the first go around, but I want to make sure you have an opportunity to jump in and let us know about, because you're talking about the mental health, you have the mental health component, and give us an overview about some of the things with mental health research and how we can, get people to stop dispelling that, mental health doesn't exist. Are you there, Dr. Lawson? I see he's there. Can you hear me? Dr. Lawson. Now see, I came back to him because I see he's joined us. Are you there? See, I don't want to I don't want him to think that we don't want to hear from him today. Okay, well, I see he's on the screen, so I'm told he's joining us just by audio. So I'm going to keep on going with the doctors that are on today. Now this is the part that we had some people who have been chiming in with questions on our chats. So I want to just randomly go over here and I'm gonna see who chimed in. So this could be to any of the doctors that are on the screen with us right now. So one of the questions that I have here is about booster shots. Why does J&J cause more side effects than the other vaccine manufacturers, especially in women? Okay, so who wants to chime in on that, Dr. McDonald? Would that be something you could chime in on?
Sure, I can mention something about that, and like I said, I'm not a virologist, and I'm not someone who's designed the vaccine. So, it looks like with the studies that were done with Johnson & Johnson, it is a one-time vaccine. Most actually all the other vaccines we have are administered twice. That's Pfizer and Moderna. You need to get two consecutive shots. J&J as Johnson & Johnson is a one-time vaccine. And with the studies that were done, they did find that there was some clotting. They did the research and they looked at this, and then afterwards they actually went back and said, well, with the number of cases that we had and these reactions that we reported, they thought that Johnson & Johnson was actually going to be okay. Now there was some caution in something that they talked about in regards to women having the vaccine. But this was all something that was researched and it was done. Currently Johnson & Johnson, I know that, once this was was researched and was in the process of being released again, something that we'll have to kind of overcome with the vaccine. Currently right now where we are, we're still giving Pfizer and Moderna. But as we get more and more time, there's more and more research, I'm sure there'll be more information about it. But I'm not an expert on the various vaccines. But I do know that, I know the effectiveness of the vaccines, but as far as the exact, Johnson & Johnson and knowing exactly, why it works or why, it would not work, I'm not the expert on that. But I don't know if I can answer the question very well.
It's not my question. It's the audience watching this.
Oh, okay, that's fine. Yeah. I hope that was helpful.
Yes. Okay. I have a question now. It says, we're looking for a mental health provider. So you already know Ms. Taylor's coming for you for this next question. We'll have insurance, and because most funds are overpopulated, what are some things to consider looking for a mental health provider for a person of color?
Well, I want to start off with, as people of color, we are not a monolithic group, right? We have different backgrounds, cultural backgrounds. When you consider your identity, you have to consider what's important to you that you want to find in a practitioner, right? So we have people in our community that come from the queer community that are non-gender conforming, that are, from the diaspora. Personally, my family's from Jamaica. So you want to think of what's important to you. Maybe you want a practitioner that's also a parent, a female versus, right? So these are things to consider. There are a lot of websites now, thank you, not a lot, but we have therapy for Black girls. We have therapy for Black men. We also have on Psychology Today, if you go on that website, you can put in your zip code, what's important to you in terms of the practitioner's identity, what focus areas you need for them to be educated around, and you'll be able to read a little bio, see a picture. People even have video, little bios, snippets of who they are. And then you can schedule a free consultation with most folks for about 15, 20 minutes and, see if it feels right. But definitely if you give it a shot and that's just not the person, do not give up on the whole effort.
That's part of the process, is to find somebody that does fit you all the way around. Now, I have a question for Dr. Sun, and then I have a question for my two dental professionals. So let me just start with the teeth now. I'm gonna ask both questions, and then Dr. Smith or Dr. Latta, you decide which one wants to jump in and give us a little quick snippet on an answer for this. How would you know if your crown is going bad after having a root canal over 15 years ago? Mine started turning colors by the gums. Not mine, that person. Dr. Latta or Dr. Smith?
I will try to get it. How will you know if your crown is going bad if it's changing colors? Changing colors may not mean that the crown is bad. Signs that the crown may be going bad, number one, would be if the crown is loose on the tooth, if your occlusion, if you're not biting down on the tooth, when you bite down, if you're not occluding just right, and your occlusion is a little bit off, or if you notice some fractures of around the tooth next to the crown. So those may be some indicators that the crown, you may be having a problem with the crown. Sometimes after a crown has been on for so long, you may get some recession of the gingival tissue, which may expose some of the tooth structure. So anytime you think that there's a problem, I would recommend that you go in and have it evaluated and assessed to see if there indeed is a problem. Okay, but just to change the color, it may be for some other reason other than going bad.
Okay, Dr. Latta, my dentist recommended Sensodyne for the pain of one of my teeth when I brush. It's sensitive to cold, and thinks I might need to have thinks I might have a surface cavity. Wait a minute, y'all. Somebody can't type. So y'all have to bear with me. I'm trying to read and understand and decipher. I'm gonna start off. My dentist recommended Sensodyne for the pain on one of my teeth. When I brush, it's being sensitive to the cold. And I said, I think it's a cavity. And that the Sensodyne toothpaste is not working. I feel as though my dentist is being dismissive. Should I start searching for a new dentist?
Well, you know, the Sensodyne is only going to treat the symptoms, and
Yeah.
it's a superficial thing. And if you're continually having a problem with your tooth, then yeah, you have to go to the dentist and have them check it out, because first off, he's going to have to take an x-ray to see if there's any tooth decay or there's any problem below the gums. But yeah, you have to have that evaluated. And I wouldn't, you know, if you came to me, I would make sure that we check that out, because if you're having kind of pain, it could be tooth decay, it could be a lot of things in there, but you want to make sure you check it out.
Thank you. Okay, Dr. San, can you talk to us and elaborate on the curved mammogram or mammography? I'm sorry.
Yeah, so there are different kinds of mammograms. The traditional one that I feel like people have heard of or are afraid of are flat plate mammograms, and they tend to squish the breast a little bit more tightly than this curved mammogram. The curved mammogram has a gentle curve like this, and it sort of conforms to the shape of the breast and allows it to be more comfortable. That being said, a mammogram should not be excruciatingly painful. It's just a little bit of discomfort for the 5 seconds that the breast is there to obtain the image. But yes, there are such options that allow us to give you mammograms that are not as painful as the traditional ones, such as the curved plated one.
I'm just going to say that for one who has had several of them, I did not find them as unbearable as most women. I'm not sure if it matters of the size of a woman's breast tissue. That has a lot to do with it being painful or not, but like, should a mammogram really be painful? Because that's another thing that, to me, it's a myth. People think, oh my God, it's painful. As a woman, don't go, they're gonna smash you to death.
Right. No, it's not like someone's injecting you or cutting you or anything like that. It's just it should be a gentle squeeze. And a lot of it is dependent on the technician who's doing it. And so we have really good technicians where I work who are very gentle, and no one has complained of pain. So please, I'm going to stress again, get your mammograms. It should not be painful. And if they are, just go somewhere else. We'll be happy to take care.
I agree. All right, Dr. Ikenna. You're getting too comfortable there, bro. You're getting too comfortable. When I see you getting too relaxed, I got to just like shuffle up the deck of cards and figure out which one can I throw at you. So let's talk about the A1Cs, the ABCs, and all those things. Because a lot of people in African American community, we suffer from a lot of those issues. It seems like our race does. And I personally haven't quite figured out why that is, but what advice would you give somebody, you know, who has high blood pressure and all those things to kind of get their overall health in check?
Well, first, we talk a lot about knowing your ABCs and not your ABCs 1, 2, 3s. We're talking about your A1C, your hemoglobin A1C, which is the percentage of sugar that's in your bloodstream, and that's the metric we use for pre-diabetes, diabetes, or normal. 5.7 to 6.4 would be pre-diabetic, less than 5.7% would be normal, and 6.4 and above would be in the diabetes range. And then B would be blood pressure. You definitely want to know what your blood pressure is, because that's the silent killer. It can lead to the silent killers, it's heart disease. So you want to have a blood pressure of 120 systolic, which is the top number, over 80 diastolic, and under, that's normal.
Sorry, you said 120 over 80.
120 over 80. That's the new standard. I know it used to be 140 over 90 and below. And they didn't do that to catch. Yeah. We didn't do it to catch more people with blood pressure or to assign more medications, prescribe more medications. It's essentially a tool to recognize that the risks of blood pressure advancing are important, and recognizing those. And so to impact blood pressure at an earlier stage. And so if you're 120 to 130, which would be stage 1 hypertension, we still might not prescribe medication, but we may say your medication will be diet and exercise, right? 140 to 140 and above, over 90 and above is going to be stage 2. And that's where we probably want to start saying, okay, if you have stage 2 and you have a comorbid condition, whether or not you're obese or have diabetes, then we're going to start talking about medications. And then C would be cholesterol, right? So you always want to know your total cholesterol. You want to make sure that's below 200.
A, B.
So yep, A, B, C. And the advice I really want to give is to exercise. Exercise is important. We want to exercise most days of the week, at least 30 minutes a day. Most days would be 3 to 5. So we want to get that. And exercise doesn't have to be Jane Fonda's or LeBron James workout plan. You can definitely do things like mow the lawn, right? That's still movement. You're still burning calories. Dancing, who doesn't like to do the jitterbug? That's definitely exercise as well. And then, eating whole foods is also important. Eating foods that are healthy, right? And so we're talking about eating the way our ancestors, I would say, used to eat. Okay, so making sure that if you're making sure that plants and vegetables and whole grains are the biggest part of your meal. If you are eating meats, making sure that's the smallest part of your meal, right? They had to make that cow last a really long time, and so it's not like they ate the whole steak all at one time, like they do now, or get it supersized. And then making sure that the animal that you are eating, making sure it's naturally grazing, so that it's not farm raised, is going to be a better option for you. And sometimes we can't do that. Sometimes as African Americans, we live in food deserts, or we live in places where we can't necessarily get a good walk in. And so that's where we really need to advocate for those as people, but then also find different ways to cope.
I agree. What I want to share with everyone, and for, you guys know we are people all over the world are able to watch us this morning, almost this afternoon. And so you guys are dropping knowledge and gems for everybody. And the great thing about having this panel discussion is that you all are experts in your field. And what you're giving to me, what you're giving to people who are watching right now, we're able to take that information and share it with somebody. And hopefully they will change the way they look when they go to the pharmacy to pick up their medication. They will stop to think about the farm-raised salmon versus farm-raised shrimp versus the whole cow, as you said, Dr. Myers, to make it, then they'll be able to talk to somebody about their mental health and understand that it's okay to not be happy every day. And you can go out and find somebody to talk to understand the importance of our oral care and oral hygiene, how, this is the gateway to other diseases systemically inside of us, to understand the importance as a female, why we must go get mammograms. I mean, everybody on here, I'm so happy that you were able to join us to let everybody know the importance of everything. So what I want to do now is to give everybody an opportunity just to do an overview in your own specialty of why people watching and listening to us right now need to make sure that they are health advocates for everything in their life. So Dr. Sun, I wanted to start with you.
So I just some last minute pearls of wisdom, I would say. I'd like to dispel some myths. First of all, breast cancer is most commonly not due to a genetic mutation. Okay, so just because you don't have a strong family history, you can still get breast cancer, which is why screening is important. The other thing is breast cancer is not the most common killer of women. It's actually heart disease. So please go get your screening mammogram. All lumps are not breast cancer. And so if you feel something, say something. It may not be breast cancer, so you don't need to be afraid. Go get it checked out. Also, if you end up having a breast cancer diagnosis, mastectomy is not always the best surgical option. But again, speak to your surgical physician about that. The last one is getting a mammogram does not mean you will get COVID. So please go to the hospital and get your mammogram and get screened.
Say that, I'm sorry, you have to take her off of mute. Say that one more time, that getting a mammogram does not what?
Does not mean you're going to get COVID. So please come to the hospital, get your mammogram.
And they take about, what's the average time from the time that you get into the machine? I'm sure there's a woman out there who's almost of age to have to get one. She's probably thinking she's going to be there for years getting a mammogram, and like, what's the average?
I guarantee that the waiting time in the waiting area is longer than your mammogram. So it should usually just take 5 minutes. 1 view, 2 views, and that's it.
Okay, thank you so much for that. And I'm going according to how I'm seeing everybody is lined up on my screen. So like I said, we're the Brady Bunch here. So Dr. Langston, I would love for you to share your pearls of, well, you don't have pearls of wisdom, your knowledge as a man of
right. Thank you. As I said earlier, oral health is a part of total health. And we can have good oral health and good health for life, but the prevention is the key. Good oral health, good oral hygiene prevents the generation of dental disease and generation of dental problems. So prevention is the key. And oral disease is related to systemic diseases, and it may be related to diabetes, to kidney disease, cardiovascular disease, dryness of the mouth, cancer and radiation therapy, and an area that we really don't get a lot of discussion on, and that's oral and pharyngeal cancer, that is cancer of the mouth and throat. So prevention is the key. See your dentist or your hygienist, get your regular checkups, and remember to be true to your teeth so they will not be false to you.
Say that, you have to say that again, be true to your teeth.
So they won't be false to you.
Well, you see, I'm smiling because I got all mine in here. Even though, I got them in here, even though right now I'm sharing a little bit of TMI, I had to go get some of my gum tissue cut away, so I'm a little swollen right here. I see a comprehensive dentist, and I am so loving you and Dr. Latta on here because so many people that I find don't even know what a comprehensive dentist is, have never seen one. And I have learned so much about oral care and oral health. And I wish maybe I should have become a dentist, but it's too late now. But I just want to say thank you to you, Dr. Langston, because people really need to understand how, like you said, this is our gateway to all those diseases that you talked about, and how getting our gums and our mouth in order can help reduce us having issues with other things in our life. So thank you with that. Dr. Latta, I definitely want you, I know you were chiming in, talking about how we need to get our kids starting off from the ground up, from the time they're inside of our mamas, to understand the importance of our teeth and going to visit the dentist. So if you would please do us the honor of sharing some wisdom with our everyone today.
You know, I'd sort of like to end this, my presentation with the idea of what role does the mouth play in the pandemic of COVID-19? You know, I've got my COVID-19 vaccine. So what happens after the vaccination? Okay, so I've developed what I call a daily dental protocol to follow after vaccination. And I use an acronym called RNS-FBG. And what does that mean? It means rinse the nose and sinus, floss, brush, and gargle. And here's the procedure that I'm using now because we've been vaccinated. I've got my vaccination. So how do I handle this situation on a daily basis? And so the treatment plan is, as I just gave you, rinse the nose and sinus, floss, brush, and gargle. So you do nasal rinses daily to cleanse the nose and sinus. You floss, you brush, and with your brush, you use an ultraviolet light to decontaminate the brush after you use it. And then you rinse and gargle with 1.5% hydrogen peroxide daily, okay? And you, of course, you exercise regularly for your general health. You eat healthy and take vitamin supplements. And you wear masks where appropriate. You know, when I go out today, what my wife will ask me says, do you have your wallet? Do you have your keys? Do you have your cell phone? And do you have your mask? So that's the apparatus that I carry with me now when I go out. And so after you wear your mask and wear appropriate, and then what you can do is take regular vacations when safe. And this simply be yourself and live a happy, safe, and healthy life. So this is the protocol that I use now when after I have my vaccination. And I sort of pass it on to everybody because, you know, when you clean out that nose and sinus, you'll be surprised how well you can breathe. And that's the first area where the virus is going to hit. It goes into your nose. One of the recent studies in in the University of North Carolina, they found out that the virus actually goes and stays in the nose for about up to 5 to 6 days before it passes on, because it kills ciliated cells, and then when it does that, then it goes down into the respiratory system. So this is a treatment plan that I use on a daily basis, and so it's something that will help anybody that's listening to me.
I think I need to adopt your treatment plan. I got some of those things going on. The weird thing, I kind of use, I'm suffering with allergies, I've noticed as I've gotten older. So I've tried the neti pot, but that doesn't work because I found out that I end up getting an earache for some type of way. I guess I'm not holding my head properly, but I use the saline to kind of just clean out. And with the allergens that are going on, definitely will say that it does make me feel better because I can inhale more to keep, all that clean. So thank you, sir. Miss Taylor. I'm sliding on down. You're below me on here. I don't know where you are in the box, but I would love for you to share some pearls. I can finally say pearls again, of wisdom with everybody surrounding our mental health and just really staying in touch and in tune with how we feel. And it's okay not to always feel like you're on 100. You might look it, but feeling is something different.
Absolutely. We have to reinforce the fact that it's okay to be human, and being human is not being happy every moment of every day. We need to make sure we're having regular conversations about mental health. We're making that a regular part of the environment in our homes and in our relationships. We're role modeling the importance of self-care in front of our children. And we're being open and honest when we need support, and they're seeing us do that. Using every opportunity we can. There's so many movies where issues come up, even song lyrics. A lot of our children admire artists that have, mental health struggles publicly. And we have to be careful to not avoid the conversation because that says a lot. The silence says, I'm not someone to talk to about this. I'm not someone that values focusing on mental health. And we have to be careful not to make insulting comments or whispering remarks about people that are having public struggles. And of course, the protective factors, the trusted adults you have in your circle, not only for your children, but for yourself, that you make sure you have a community like AAHP and everyone here. You have all those people that are a part of your team, school officials, your church community, your family, close friends, and do not shrug off any behaviors like isolation or hopelessness or lowered grades or changes in sleep or eating habits as teenage angst. It's just a phase, right? And for you yourself, if you're having unexplained headaches and all of those things, be cautious, take the time, get everything assessed. It's better to hear good news than be in the dark. And thank you.
Well, it's not over. We're just getting
I love saying thank you, don't I?
Okay, well, you're welcome. I said you're welcome. Dr. Nancy, I'm telling you, you'll be my pharmacist on call when this is over. Dr. Nancy.
Yes.
How I'm supposed to feel, what's happening, but I am excited. I'm loving your smiling energy because again, now I know that I'm not crazy when I'm holding up the line because I'm over to the side where it says, the console. I'm that person that after hey, can we talk for a second? I need to understand because again, I'm not one for just taking pills just because anyway. And I will, right. Even though I'm prescribed something, I'll go get it filled. But then there's a part of me is like, nah, I really don't know if I want to take this because I'm just not sure how it's going to make me feel. And there's medications I found out that I took as a child, well, not a child, but as a young adult in my 20s that caused a certain reaction. And I'm wondering, could I still take them in my adult years? Will that same reaction come about? So should I be concerned about something like that? Like say, for instance, Tylenol 3 with codeine. In my 20s, I used to get sick to death with codeine. But now I'm on a codeine right now and I'm feeling great. So, does age have anything to do when they prescribe certain things to people or does it matter?
It could be a few things that's happening there. typically what we see that more likely with or associated with is penicillin allergies. A lot of people are allergic, or they were told they were allergic to penicillin as a baby or as an infant or as a child. And then as an adult, statistically speaking, most people are no longer allergic. And so it's something that you need to let your providers know. The side effect of having an upset stomach or feeling nauseous is really just an adverse event. It's not an allergic reaction. And it could just be that you were sensitive. Codeine can be a little rough on the stomach just in general. I'm glad you use that as an example, because people say, I'm allergic to Tylenol with codeine. Well, I now have to ask, well, which component? Is the Tylenol part or the codeine part? And if it's an upset stomach, then we have to look at the benefits outweighing the risk, and then checking and seeing if you were taking it on an empty stomach or with food. So there are times as you get older, you will react differently to certain medications. It's not necessarily an age relation as much as it may be an organ development or your body weight or your size or the dosing. So it's something to mention and something to be aware of. But if it's something where you can't breathe or you suddenly lose consciousness, those are items that we will try to avoid the entire class unless you're in a hospital situation where they can manage that reaction. But we'll try to avoid that. But some people like to say it when it's really an upset stomach, and then you wind up being given something else that has a larger side effect profile, costs more, and can cause additional damage. And so be honest and open about what the reaction is. And when someone asks you, are you allergic to something, you can tell them that, and they should be following up with what happened and when did that happen. So that's important. And I want to mention that we discussed some of this within our African American Health Program, Kickstart Your Health. We cover diabetes, cardiovascular, which is hypertension, and also cancer. And we mentioned, and we have a section where we talk about medications and adverse events. And so it's a great opportunity to come ask one-on-one questions with me during that time and to get some further insight into medications that you're taking.
I love it. Well, hopefully everybody on here is not on a lot of medications, because Dr. Myers already told us, don't eat the whole cow. And if
right.
Make sure your cow was eating some good grass that didn't have any fertilizer in it and was out there grazing. That's what you said, right? I'm not putting words in your mouth, but you gotta have some
grazing cows.
And that's why I like our programs, because people will often ask me, when can I get off this medicine? And I would often look at their cart and say, when can we change that cart? And they would say, well, don't come for my soda and my cakes. And I said, then I'll see you next month. So the answer isn't to keep taking the medication. The answer is to change what you're eating. As a pharmacist, I did much better when people didn't take as much medication. So I prefer it if we could just change our lifestyle and use medication when we need to, when we have to. And you've heard from our two dentists that are on the program, your mouth is such an important gateway. I would be remiss if I didn't take just 1 second to say smoking cessation is so important. The mouth is one of the fastest ways to get things into your bloodstream and into your body. And even if you're not inhaling the smoke, you're holding it in your mouth and it's going into your bloodstream. So that's something else I like that.
And I'm glad that you said that, because I tell people all the time, you're either going to pay for higher priced foods if they're organic, or you're going to pay for higher priced prescriptions later. That's how I'm looking at it. And it took me this many years. I'm 54. It took me over 50 something years to decide that, hey, I'm gonna stop eating this or drinking that because it's making me feel this type of way. And I wish I knew about all the benefits of being plant-based and eat your meat, eat your chicken, cow, eat everything with eyes, I say. But everything's about moderation. I'm thinking all the Hostess and Twinkies and Oreo cookies. I was everything. I'm in my 20s, but that stuff does catch up with us. And like you said, you see people who are on all these prescriptions and their thought process with me talking to them, well, I have high cholesterol, but I'm gonna eat shrimp because I take the medication. And to me, as a pharmacist, it's not really balancing out. A doctor like Dr. McDonald might want you to not eat that Hostess, those Oreos, that a gallon of soda, and still have to take medication because you're not really doing your body any service. But we all can have our own thoughts about the pharmaceutical companies, or in business, pretty much as long as people are sick and need to take their medicines. So Dr. McDonald, I would love for you to chime in and give us some wisdom about our health. And because everybody on here is going to live to be at least 100. So I want all to celebrate our birthdays.
That's right. We hope so. That's for sure. Well, the last thing I was going to say was just really just to drive home the message about where we are in the pandemic. You know, we've seen us, you know, we're over a year now. We've gone through all the different stages. You know, it's still very troubling for me whenever I see patients in the urgent cares who are coming down with new COVID cases. You know, knowing that there's a vaccine and knowing that there's help. You know, one of the things about the African American community, I think because of the fact that there's so many of us that are essential workers and that we've actually bear the brunt of the pandemic. And that's what you're seeing. So a lot of essential workers, people with pre-existing conditions are the ones who are more prone to get sick from COVID. So those, especially people in those, you know, those categories should especially get this vaccine. We opened up from 12 to 15-year-olds recently. That was just something that was released from the FDA as well as the CDC. And so we're doing that as well. And there's very few reactions. But the final thing is just, you know, now we're turning the corner. We have a chance to kind of get through this. I just really want to emphasize the importance of getting a vaccine. And please, I don't like to see patients with new viruses. I mean, I see people coming in with new diagnosis, and it's very troubling because I know exactly what they're going to go through. You know, anytime that you cough, you sneeze, you know, fever, chills, headache, even nausea, vomiting, abdominal pain, whenever you present with those symptoms, you have to be screened for COVID. You know, you have to go into a special area, you know, negative pressure room where they have to come and check on you and test you. And, you know, and if you're positive, you know, you have to go through the process of having COVID. And not everyone, we don't always know how we're going to end up with that. So that's my last thing I want to say is please, 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 everyone, get your vaccine. You know, protect yourself, wear a mask, wash your hands, be safe. That's I mean, that's from the bottom of my heart, you know, but I want to make sure everyone understands that.
Okay. And I am not a doctor, a physician, a dentist, a mental health expert. I'm out of anything. I'm a mother, I'm a sister, I'm an aunt, I'm a grandmother. I am just someone here who is on a panel of experts. And it has been a blessing to receive all this information because I think the one thing that we share, no matter what our skin color is, that we're all humans. And we're all susceptible to this COVID-19. We're all susceptible to any type of diseases that come into our body, be it in our mouth, be it from cancer, like you were saying, it doesn't matter. I tell people, you know, they say, well, I have high blood pressure because my mother had it, or my uncle had it. Oh, I have this because so-and-so had it. But I've seen in my own family that even if we have everybody might have something, but doesn't mean that you have to get it. But it all starts as far as like what we put in our body, how we take care of ourselves, how we stop relying on that the only way we're going to have a great life is to go to a pharmacist. No offense. I mean, if you got to come see you, we're going to come see you. But I try to get people to understand, you know, like Dr. Latta was saying, getting everything started from ground zero when the babies are internal before they get here and what the mothers are putting into themselves. All that has an effect on all of us being on here today and all of us knowing, you know, how important our health is overall. And if there's anything that I would want to say to those that are watching is that every doctor here, every mental health professional here, every dentist here, they're giving us all opportunities to look at ourselves and figure out what do we need to do to get ourselves in check. When's the last time we went to the doctors? When's the last time, if you're a male watching, that you had a prostate exam? Have you ever had one? Because I know that could be a touchy situation for men that are watching us. You know, when's the last time you had a mammogram? Have you had one? You know, are you taking your medications on time? Are you skipping dosages? And if you are, let me jump in there right for a second. If you are missing your regimen of your pills, can you double up? I know I digressed a minute, but can you double up or you shouldn't? Should you just stop taking them or?
No, do not. If you're asking me, no, do not double up. That's not the solution. Try to have a consistent schedule. Place them someplace where you're going to remember them, on the nightstand, if it's in the kitchen, not in the bathroom. It's too humid. Some of the pills will start to degrade. But if you miss one, take it as soon as possible as you remember. But if it's close to your next dose, then do not take that dose. Do not double up. It's not an idea of, oh, I have to take this 3 times a day. I'm going to take all 3 tablets at once and avoid that. Not every medication works that way, and you'll wind up taking too much at one time and not being able to cover your body's need or throughout the course of the day. So each medication is different, and it will have specific instructions on that nice long sheet you had there, but that's another question to ask at the register. What happens if I'm supposed to take this at 9 a.m. and I remember it at 1 p.m.? You would take it. But if you remember it at 7 a.m. the next morning, do not take 2 doses. It's important to understand when to do that.
You've answered my question as I'm taking something and I think I might have missed it, but that's my fault. That's just called, I gotta, like you said, put it someplace where it needs to be. I do have a question that came in and I'm not sure which person could answer this. What is VR simulation? Who would that go to? What doctor can answer that? Does that make sense? It just says, what is VR simulation?
Oh, I can answer that question. I think they're talking about virtual reality simulation.
Okay.
I mean, yeah, I mean,
We didn't know what it meant. Everyone.
Okay, virtual reality. No, I mean, early on in the pandemic, you know, looking at different ways to approach medical training and other things. You know, I had worked. You know, I have three kids, and so you know, we had to do different projects, and so I worked on trying to design a virtual reality simulation around the COVID pandemic, where you could actually, you know, have virtual reality where you could see a virtual patient, prescribe a therapy, a treatment, and so you could train people. So I started working on that. I never quite finished it all, but I did set up, you know, some things. And so I just think as we have these new challenges, we always have to think of other ways to approach it, other ways to fight it, other ways to train. I always try to teach my kids as much as possible, you know, make sure that you're open, you're creative, and that you're willing to do what it takes to fight and meet these challenges. You know, because I want to make sure that the next generation is ready for this. Because I kind of almost feel like, you know, when this hit us, we weren't really ready. You know what I'm saying? We weren't mentally ready. We weren't really physically ready. We weren't ready as a society to handle this. So my goal is to make sure that our kids and you know, and especially African-American children, kids everywhere are ready for the next pandemic, because there'll be other ones in the future. So we got to be ready for it. So whatever we can do to train and prepare ourselves, we need to do, for sure.
Well, I'm hoping, well, again, I don't want to be here for the next one. I want that to be like 100 years from now, but you know, but whatever we can all do as we're on this screen, leaving our legacy, leaving our knowledge, leaving something for the next generation, like you said, so they know that they too will be okay. And as they say, this too shall pass, because again, it's just evolution. Things that go around come around. I tell, you know, people all the time, the same outfits that we're wearing now, our grandmothers wore and their grandmothers wore. It's like you can't cut fabric with so many ways. You can't style your hair with so many ways. You can't have it so many fronts and gold teeth and everything else with so many ways. So we're just an evolution of what came before us. And so whatever that we can give and partake to the next generation, the knowledge that you guys have shared with them today, you poured into me as well, because you know, people think they know it all. We don't know it all, but it takes people like you to help let people know that it's going to be all right. Get your high blood pressure, diabetes, kidney, get everything. You know, you make time to go out and buy the cars, the fancy shoes, things like that. I tell people, pour those dollars into your body and your health. Let this be your car. You know, when your car doesn't have headlight broken, but you walk around with a tooth broken. That's the problem to me. And as a dental professional, y'all should know that. As medical professionals, we got to start taking better care of ourselves. So with that, that's like, again, like I said, that's my 2 cents. You all have given the dollars, the 50s and all that. And what you have given today, people would have had to go pay for. And it's priceless information that you've shared with us. So I want to say thank you to each and every one of you for joining us. And for those who are watching us on Facebook, by all means, if you are not going to see one of these professionals that have joined us today, make it a pledge and a charge that you, as a Monday, make an appointment to go talk to a health professional. If you need to talk to someone in the mental health field, go sit down on someone's couch. Sorry, you can't call me. I know I talk a lot, but I'm not the one. You need to get someone's license and, you know, go schedule your mammography. Do everything, as I say, around your birthday, because that's the best present that was given to the world, is the gift of your life. So schedule your dental, schedule your everything around your birthday so you don't forget, and make a commitment to your being your own best advocate for health and wellness. Anyone want to say anything else before we say, because now it is time to wrap up, and I've enjoyed this. But does anybody have any last minute anything? Because I definitely want to thank every single person for participating with us today. But I want to just say, you know what, we went around. Did I get Dr. Myers? Did I get you, bro? Because I know I'm picking on you. Did I make
No, I think everybody did such a great job of kind of wrapping up. I don't really have anything else to say, but other than to reiterate, make sure we're creating cultures of health within our homes, which includes, which starts out at when we're babies. So exercising, eating the right foods, but also don't forget having a healthcare team that includes a pharmacist, dietitian, mental health, primary care physician. And if they look like you, whether it be Black or Latino, that's even better. There's mounting evidence that shows a healthcare professional team that looks like you improves all of your health outcomes, right? And so we want to do that and make sure you're holding any health professional that you have accountable because they work for you.
Say that again, they work for who?
You.
See, people have a hard time believing that. There's sometimes I think that they don't understand. They go in there, like you said, when I go, they're probably like, oh Lord, here comes Micheline. But I have to remember, so I have to write stuff down because I'll think about, oh, this hurts, that hurts. But by the time I make the appointment, and unfortunately, sometimes it could be a month or whatever before I get it, it doesn't hurt anymore, and I forget. So I agree 100%. Everybody watching and listening, it doesn't matter if you're 22, 52, 62. If you're going to your healthcare professional, that's your job, is to make sure that they address everything. And I found that sometimes I'm telling them what's wrong instead of telling them my symptoms. I'm so busy being a doctor, self-diagnosing. That's why I said WebMD. I tell you, I have 3 fingers and 9 toes right now if I listen to them. But write it down. Dr. Taylor, you laughing at me, Ms. Taylor, you laughing. Write it down and understand. Dr. Nancy, I'm coming to see you too, so you laughing at me too. It's not, write it down and make sure that you are your best health advocate. If it has to be, it's up to you and me to make it happen, all right?
Micheline, one thing I went to mention to you, what I use for the rinse, I use the Neomed sinus rinse, and I don't use regular table salt, but they have a buffered salt in there, so it's a lot better than using regular table salt.
That's something we can get from, I guess, our pharmacy or CVS or.
Yeah, they have them at CVS and all the pharmacies. You can get the whole kit, and they can go. I think online they have bags of 100 of the salt rinse. But I find out I think if you use this rinse with not the regular, we're using regular table salt.
For my neti pot, some type of solution that comes with it. I don't know the name of it.
Okay.
It was some type of solution that came with it. But the saline is just the saline I squeeze. But the neti pot had whatever the little packets, I'm honestly not sure what it comes with. And that's another thing. I'm just putting stuff in my nose, not even sure what it is. And
there's similar saline rinse to the Neil's solution.
Okay.
Yeah.
So that's something I can come and ask you then, Dr. Nancy.
Yeah.
Yes.
Thank you all so much for joining me again, and for everybody who has tuned in for this AAHP Community Day. You have been watching our expert panel discussion, and we have been joined by some phenomenal people in the healthcare profession. And we look forward to all the great things that are yet to come out of you all. Dr. Myers, bro, I'm gonna always be messing with you now that I see that you want to asking you questions. And for those who want to get in touch with you, I know that the organization, I'm sure, has everyone's information, because I'm sure once we close this session, that's when people are like, oh, I wish I could have asked them this or asked them that. So I hope that you are definitely open to having people reach out to you or some type of way. And if you can on here, put your information in the chat, everybody, so that way we can take that. And if people have some questions they might want to reach out to you directly, they'll be able to do that. And you don't know, you might end up getting some new clients out of all this, because you guys have shared with us. And of course, we're sharing with them. Thank you guys so much for joining me. Now, I'm going to stay on here because I got to do what's called a wrap up of the day. And I'm going to let you guys continue on with your days. And I always tell people, it's never goodbye. I always just say you have the best of your life, because your best every day is yet to come. Thank you for smiling with me, Ms. Taylor. You got my day going. You got my health feeling good.
Thank you. Again.
Yeah, Dr. Nancy, we're going to be friends for life here.
That's great. That'll be fun.
I'm going to find you,
and
Dr.
Get your mammograms.
Yeah, I got mine done. Dr. Myers, I'm going to find you. Dr. Langston Smith, I thank you, Mr. A5A.
For sure, for sure. Good to be with you.
Thank
and we're happy that Iota Upsilon Lambda chapter is able to sponsor our game this year.
Dr. Smith, I'm your frat brother.
Oh, Dr. McDonald, you are Alpha as well?
Alpha as well. That's right.
Well, 06, Dr.
06,
McDonald, brother.
06,
All right.
brother, 06.
Well, since we're saying that, I'll say 08. Hello, my frat brothers.
Let me just jump in here and say, ooh, how about the Divine Nine up here? I'm not mad at all, y'all. I love it. Oh, well, see, I tell you, that's another segment, Greek that are in the healthcare profession, because people don't understand. I tell people it's not the colors we wear, it's a sisterhood and brotherhood we share. It doesn't matter where you pledge, what you are, we might have that tit for tat, but when it comes down to our brothers and sisters, healthcare we're all in this together. This is a fight we're all in. So this makes me feel extra proud. So we shout out to Divine Nine on here. Okay, Dr. Are you part of our Divine Nine, Dr. Myers? Not that it matters. I'm just.
No. We didn't have it at Davidson
You're
College.
part of the brotherhood. You still part of the
But he's a part of the brotherhood.
That's what I'm saying. You part of the
It's
brotherhood.
all about service.
Well, when they talked about the alphas, I'm in the other end of the alphabet. Q Psi Phi.
Well, hello, my brother. See, that's why. See, I have one kind of a goldish color. Yeah.
Dr. Latta?
Yeah.
Would you please say hello to my friend Stephen Whetstone?
Yeah, I will. Oh, you know Steve, huh?
Oh, yes, we work together.
All right, I will. Yeah, Steve is really great.
Yeah.
All right, everybody. Well, you guys can sign on off. I got to stay here and wrap up this amazing.
Okay. All right. Thank you.
Have a great day.
Have a great day now.
Bye-bye.
Take care. Wow, that has been, I'm overwhelmed. I truly am overwhelmed. This has been an amazing community day. I'm hoping that everybody who has been watching today has had some great takeaways. I know that I have. Again, I still have my container pot here. See, I'm growing some curled parsley. Y'all see that? She's not looking too healthy right now. I think I might have to give her some more sun, but I'm going to start my garden. GirlTrek, yes, GirlTrek has been a part of this. This morning, I actually saw a neighbor and she had a GirlTrek t-shirt on. I did not know that she was part of GirlTrek. So we're going to start doing some walking together because they do some great things all across the chapters that they have here and there. If you don't know about GirlTrek, I would love to invite you to find out about it and become a part of it. With the summertime here, cooking light, cooking healthy. I'm definitely going to make some smoothies because right now, like I said, with my mouth a little sore, the smoothies would do my body some type of good. And they look so fresh and so healthy. I just want to take time to say thank you to all of the presenters that have been part of today. They made this day happen. A special shout out to the AAHP program staff and the Iota Upsilon Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. Thank you to me, because I thank you to you all for having me become your MC, your host for today, and of the video crew at Applied Integrated Marketing and Design, Daryl Harris and Kayla Scott. Big shout out for you for making this happen. And of course, the executive committee of AAHP, all of the partners. I mean, I don't want to miss out. Okay, Miss Jessica, I didn't want to miss out anybody by calling out every individual partner organization because there were so many. And I just want to say that everything that you have done to make this event happen today, down to the volunteers, to Brandon, we can't see you, Brandon, but thank you, Brandon, for just being amazing and helping get me all together doing this whole process. Miss Pat Grant, for inviting me to be your MC again. It's been a few years and I cannot wait to, if I'm invited back, that we are all together in the same place, same space to enjoy a community day in person. But until that time, I want everyone to make sure that they stay in tune to themselves, understand that you are important, your community is important, getting involved is important, and everything that you do it to the best of your ability and you do it for yourself. I'm gonna say thank you again. The African American Health Program Community Day Event 2021 is a wrap. So get out there and enjoy your best life.